Assalamu alaikum, the communication day. The first scenario, the case about atrial fibrillation to start Dabigatran. Mrs. Stewart is 40 years old lady who has been referred to your department by her GP for persistent palpitation for the past 2 days with irregular pulse on ECG. She has a past history of poorly controlled hypertension and she is not compliant on her ramipril 5 milligram once daily and missing on her follow-up visits. The consultant diagnosed her having atrial fibrillation due to the poorly controlled hypertension and has decided to start the lady on dabigatran to guard against any complication, awaiting a further assessment and a decision as regards her AFib. Your role, you are the senior house officer in the cardiology department. Your task is to update Mrs. Stewart as regards her clinical condition management plan in the term of starting dabigatran and to address any concern she may have. If you're ready, Dr. Salma, we can start.
Okay.
Okay, here you go.
Good morning. My name is Dr. Abdurrahman, the doctor in the heart department, heart clinic today. Can I confirm that you are Mrs. Edward and you are 40 years old?
Doctor, I am.
Nice to meet you, Mrs. Edward.
Nice to meet you too, doctor.
Okay, so Mrs. Edward, we are here today to discuss some issues regarding your health condition and to address any concern that you have. Are you okay with that?
Yes, doctor. Okay.
Okay. So, Mrs. Edward, before we start discussing your health condition, can you tell me a little bit about how much do you know about your health condition?
Not so much, doctor. I was hypertensive
Mm-hmm.
and for some time, and I was not regular in taking my medicine.
Mm-hmm.
And doctor, I don't know that I'm waiting what I will be needing right now.
Okay. I appreciate your concern, Mrs. Edward. Can you tell me what do you expect from our meeting today?
Nothing, doctor. I'm just what I'm gonna do. What is the result of my investigation, my test they did before?
Mm-hmm. Okay. Mrs. Edward, can I ask you one question before we start discussing your condition? You said that you was not adherent to not taking your medication regularly. Is there a specific reason why you are not taking your medication regularly? A specific concern or something?
No, doctor. Just I was like busy with the kids.
Mm-hmm.
Nothing.
Mm-hmm.
Just a little bit days.
Mm-hmm.
I remember to sometime and forget sometime.
Mm-hmm. Okay. So, Mrs. Edward, I appreciate that you are a busy mother and taking care of your kids, but your health has a priority because they need you healthy to be able to take care of them. Today, I'm here to discuss your health condition and yes, you have a long history of hypertension, which was poorly controlled because, and I can understand that because you were busy and not taking medication. But as a result of that, unfortunately, some bad outcome happened from the effect of your hypertension in your health. That is we called in medicine. I'm afraid I don't have a good news for you today. Are you willing to hear more about this?
What, doctor? What do you mean?
Okay. So, Mrs. Edward, as I told you, as a result of this long-term uncontrolled high blood pressure, your heart is affected now. and this resulted in a problem called atrial fibrillation. That is a problem in how your heart beats. It became now irregular. That means it is not regular like before, and that affects how your heart is pumping the blood to the body. And this condition, unfortunately, can result in a problem in the how thin is the blood, and make it more thick, and make you in a hazard of having a clot in your body. Are you following me?
Yes, doctor. So it's serious, doctor?
Yeah, I appreciate your concern, Mrs. Erwood. Yes, it is serious condition because one of the bad outcome is a clot in your blood channel, which can travel to your heart or to your brain, and resulting in what we call it a stroke. Have you ever heard about a stroke?
Yes, doctor.
Mhm. Mhm.
I
So,
know what is this.
yeah, I'm sorry to tell you that this condition need to be controlled and treated by our team, and that's why the treating team have decided to add a medication to your medication to control this heartbeat and make it return to regular beats, and also to prevent any further side effect like a stroke we explain now from happening to you. Okay, we will put you on a medication called Dabigatran. Have you ever heard about this medication?
No, doctor. What is
No,
this medication?
okay, I'm going to explain to you. So this Dabigatran is a medication which make that your blood more thin, and also regulate help in regulating your blood, preventing from happening from resulting in a stroke. It is a blood thinning medication you need to take, and you need to take care after taking this medication because it's a blood thinning. We are going to start you on this blood thinning medication, and we are going to follow you up with regular monitoring of the thinning of your blood. Is this okay with you?
Doctor, I had a friend who ended up with a stroke because of bleeding in her head.
I
Because she was
appreciate your
receiving a blood
concern.
thinner like that, right?
Mhm. Yeah, I
I don't want
appreciate
to
your
take
concern.
this medicine.
Yeah, I appreciate your concern. I can understand your concern, but unfortunately, if you do not take this medication, a stroke from clot also can happen. It is very hazard for your life. And about bleeding, it can happen. There is no medication without side effect, but with good control and follow up. And also, I'm going to give you some precautions that you will take and help. The reversal of this medication will be very easy in case you notice any like small bruises, like bleeding from your nose or your gum, any abnormal tiredness, any change in the urine color, any change in the bowel color also. Any abnormal symptom that you have, you can come to us immediately, and don't worry, we are going to take care of that.
2 minutes left.
So Mrs. Edward, do you have any other concern?
So, doctor, I will not have any complication, like heart attack after starting this medication?
Uh, the, 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 the medication that could happen to you from the uncontrolled hypertension is too much minimized by taking this medication. And the follow-up, the regular follow-up with the team will also we will also make sure in the follow-up that you are not subjected to communication. But unfortunately, I cannot tell for sure that you will not have any communication. But after taking this medication and controlling your blood pressure and being adherent to your medication, hopefully that the complications will be less, if no at all. I hope that answer your concern, Mrs. Edwards. So,
Uh,
okay.
Doctor, for how
So,
long I will be taking this medicine?
mhm. So this medication, you might take it for life, and the time exactly decided by the team that they will evaluate you and sit with you, and by the follow up, and the in the next time, but it could be for life. Okay.
Okay, doctor.
Okay. So, Mrs. Edwards, can I ask you some questions?
Yes, doctor.
Okay, so what about your job? Do you have any? What is your job, and do you have any stress in your job?
I am a teacher.
Okay, do you
Yes,
have
of
any
course.
concern?
Of course, affecting my job, doctor.
Mhm. I'm sorry for that, and it's okay. We are going to sit with you and help you by what we can. So, do you smoke?
Yes, doctor.
How many cigarettes per day, and for how long?
5 days for 2 years.
Mhm. So, because you have this problems, smoking is dangerous for the health generally. But because of this problem, also smoking now, you need to think seriously for stopping smoking. And if you cannot do that, I can just refer you for a smoking cessation clinic. Is it okay with you?
Okay, doctor. Thank you.
Okay. And do you drink alcohol?
No, occasionally.
Okay. And do you drive?
Yes, doctor, I'm driving.
Yeah, okay. Is this problem affecting your drive by any way?
Mm, no.
Okay.
Okay.
Time is up. Thank
I
you.
need to ask about
I added
social.
1 minute. I added 1 minute for your concerns.
Uh, Maybe I took time in explaining the condition. That's why.
Yeah, we will comment on that.
Mm, okay.
But in general, you did well. Okay, let's hear Dr.
Yes.
Bakinam comment, please.
You did well, Dr. Salma. Very
Okay.
well. Okay, but only sympathy and empathy. Yani, I didn't get the chance to like make a scene about the because you're
Uh,
a lot of information, a lot of
yeah, I felt
so
like
and
that I
also
give a lot of
the
information.
concerns came a
Yeah.
lot in the end because you already talking. You uh, just
Uh,
you didn't give me the space to start it earlier.
uh,
Just like that, but you answered all the concern in the right way and perfect. I have no
thank you.
comment.
Okay,
Thank you.
I have fatal comment for Dr. Salma because of clinical judgment.
Mhm.
You said to her the medication will correct or regulate the heartbeat, right?
Yeah, I hesitated then when I said this
What do you
sentence.
think?
I
Dabigatran, what?
didn't complete it. Yeah, I hesitated then
Yeah.
because I think I didn't read the scenario well.
Mhm.
Because I was thinking what they are going to give her to regulate the atrial fibrillation, and I have to tell her about. When I started this sentence, I didn't know how to go back from it.
Yeah, yeah,
Yeah, so
it's
I
not a
just
kid.
cut it in the middle and
Mm.
go to thinning your blood. Cut it in the middle
But
just.
believe me, some
Mm.
examiners are
Will
very
get it.
tough.
Yeah.
Yeah,
Yeah.
they might make like you are inventing plus miss
Mm.
judgment for the scenario. So the clinical judgment by you was
Mm.
incorrect by
Mm.
prescribing this medication
Mm.
or assuming this medication will make the heartbeat is regular. So I think
Yeah.
don't, yeah, you have to read the scenario of course well, focus
Yes.
on every
Yeah.
word.
Yeah, now I read it.
and
They were
yeah,
awaiting for further assessment and decision as regard to her atrial fibrillation. I should tell her about treatment of the irregular pulse. They are going to set another meeting and tell you about after assessment about the decision regarding regulating this pulse. But now they will
perfect.
start
Yeah,
you in blood thinning to prevent you from
exactly.
having clot. Yes, now I
Yeah.
understand. Yeah,
Okay, let's go
yeah.
back to the main task of this scenario. I made short video about how to counsel about medication. You
Mm.
didn't talk about anything about this medication. You just said we will start to prevent stroke. But what, how the medication will be taken, how the dose, the frequency, the
Mm.
route, possible side effect like this, mechanism of
Uh,
action.
I, I told about possible
I
side
think,
effects and precautions
yeah,
only.
yeah, only that I think. But
Mm,
you didn't take any time to explain this is oral medication. It
mm,
was be or supposed to be given once or BID. I am not sure, but anyway, at
mm,
least give him some description how the medication will be taken in
yeah.
regular manner, daily basis, right? You have to be
Mm.
compliant to this medicine. You mentioned that, and
I
avoid
wasn't sure
any.
also. I wasn't sure also how it is given. Oral, yes, but
It's oral.
in a daily basis,
All
yeah.
yeah.
وبرضه مش
I
مكتوب
guess
عندي.
it
It's
was
not written
BID.
on me.
Mm,
Yeah, if
So
you
I
know,
didn't think also.
mention. If not, yeah, if not, you can say only oral. It will be given through your mouth, or you can swallow it. And
mm, mm,
be careful of some side effects of bleeding. So please avoid any strenuous exercise or vigorous exercise, any sports that might lead to
mm,
bleeding.
mm,
And if you feel, as you said, safety netting, if you feel any bleeding or some bleeding
mm.
in your gum or any area in your
Bruises
body,
and excessive
bruises, visit
tiredness,
us.
or yeah.
Exactly, yes.
Mm,
Because
yeah.
it was one of the major concern for the patient that I'm afraid of bleeding. Some of my
Mm,
friends had the bleeding. So you have to assure
First
him
concern.
whenever you are, yeah,
mm,
whenever you are taking regularly without excessive dose, you are safe, supposed to be safe, unless you have, for example, this exercise or some heavy job to
mm,
do. Please avoid
mm.
them. They might lead to that.
Okay.
Yeah, I guess this was the point. Yeah, so you explained more about hypertension initially, and the task was about.
I thought it is important that to make her notice that non-adherent to her medication was the reason, but in a nice way. That's why
Yeah,
Yes, this
I
is
asked her first
why.
that
Good
what
point.
prevents you from taking your medication to use it to
Without
make her
blaming,
notice
okay.
this without
Mm.
blaming. Yes, when
by the
she
way,
said that her kids and she taking care of her kids, I admire that she's taking care of her kids, but they need you healthy.
yeah, it's a good point to mention, by the way, because you are
Yeah,
going to prescribe another medication, and she might also be non-compliant to the new medication. So you have to, yeah, to emphasize this issue to make it sure about taking both medicine for her condition, because also hypertension, as written in the scenario, one of the causes of her AFib. So it's a good point to mention, by the way, for the welfare you have to speak about. Apart from that, you did great. The job, okay, you have to ask about the smoking, alcohol, but I don't think driving here is an issue to be raised, and I don't think it will be affected by here. You got it? So you can ask only if there is some effect from the disease. But in this scenario, I don't think any affection by the job or by the disease itself.
sorry,
Okay,
sorry, I didn't hear that.
the
I
driving,
have
the
a call
driving
coming
is not
to me. The driving,
yeah, the driving,
yeah,
yeah, is
mm.
No
it won't be
related.
affected here. Yeah, it's not related
She,
at all, either to the disease or to the stroke,
mm,
or sorry, to the medication or to the hypertension or to the
mm. I
complaint.
was I was just hesitated because taking a blood thinning medication, if she told me like I have any problem with driving nowadays, I'm not seeing well, I will stop her because she will take a blood thinning medication, and if any accident happen to her or problem, it will be problem. So that's why I
Suppose,
asked
yeah.
as a complementary of the social history.
Okay, suppose if you want to advise about avoiding something, it would be heavy sports or heavy job or carrying
Yeah,
objects
you're right. You're right. Yeah.
rather than driving itself. Okay, this is
Yeah.
my
Dr.
comment.
Basil?
Anyone has comments? Yes, Dr.
Yeah,
Rashid,
yeah,
go ahead.
yeah. Yeah, I have few comment, Dr. Salma. I
Mm-hmm.
think regarding this task, here you need to talk about atrial fibrillation mainly. You will tell the patient you have irregular heartbeats. And if you and you explain what is this irregular heartbeats and what are
Yeah,
the
that my
complications.
problem that I took more time in explaining this.
Yeah, and
Yeah,
second
I
thing,
wasted more time. Yeah.
in addition to Dr. Basim,
Mm-hmm.
here your main task and the bulk of the mark on the
Mm-hmm.
talking about this medicine, not about other.
Mm-hmm.
You need to take
Mm-hmm.
this is the anticoagulation. You need to tell the patient we will start you in a new medicine. This is a well-known medicine, and will give
Mm-hmm.
you a dose just to control your heartbeats and not to
Mm-hmm.
harm you. Then
To
you will
control your blood thinning
yes, then you will
only.
explain the patient more about the side effect of this medicine. Other than that, this is anticoagulation. We need to refer patient to the dietitian, okay? And we need to tell the patient if you took any other medicine for any chemist from any pharmacy, we need to tell your
Mm.
doctor because there is some interaction.
Yes.
Apart from that, we will end it by safety netting. You will tell the patient about the safety netting. If you develop bleeding at any time, please
Mm.
visit the emergency or like this. This is the
Okay.
main task.
Yeah. Okay.
Yes, there is some comment from Dr. Maha. Thank you for reminding about these things, Dr. Maha. It's precious comment, really. The card itself is very important. So remember to mention the card or bracelet in some medication, like a steroid and Addison. You have to prescribe a bracelet or to at least tell him you have to wear this bracelet. For the anticoagulant, yes, there is card supposed to be carried by the patient, which is
Mm.
a very important thing to be offered here. Thank you, Dr. Maha. Dr. Mayada
Welcome.
also, yeah, some,
Can you
yeah,
explain
I
more
guess,
about the card, doctor?
yeah, it's a paper or card to be carried in her or his wallet
Mm-hmm.
that he's receiving anticoagulant.
Mm-hmm.
If you went
Mm-mm.
to
Okay, and this is not for
this
only can
medication,
anticoagulant for any medication. Yeah,
manage Dr.
supposed to
Bassett
be
for interruption.
yes.
Yeah, like if the
Okay.
patient went for the dentist or if he have any surgery, okay, he will give the
Mm-hmm.
card that I'm taking Dabigatran, okay. That means he's taking anticoagulation. There is possibility for bleeding, okay. So this is a
Mm-hmm.
card. Why?
Mm-hmm.
Yeah.
So,
Thank. Yeah.
what is the difference between dabigatran and warfarin? What is the benefits or the advantage of dabigatran above warfarin?
The
It's for
interaction.
manage for
No
INR.
monitoring.
Interaction and
Yeah, the
for
monitoring and interaction. Exactly. Yes.
Monitoring and interaction. So, do I have to
Exactly.
mention
Yes.
that regular monitoring with INR should be
No.
like
No.
I am
No.
explaining
No need.
warfarin?
No need.
Do
no
I
need.
have to mention also the drug interaction and nutritionist and these things like warfarin?
The
Yes. Oh,
interaction.
we need.
Yeah. Yeah. It's only if he will be or she will be prescribed on another medication. So to be informed about her GP
Mm-hmm.
that I am taking a medication already, which is already the task of the GP. If he will prescribe new medicine, suppose he will ask,
Mm-hmm.
"Are you on any medication?" So it's
Mm-hmm.
from both side. I mean, okay, from the patient side and the GP side. But for the warfarin, you have to enumerate the side effect, like interaction with some foods, vegetables to
Mm-hmm.
avoid, and alcohol. Some of these will make the effect high, and the risk of bleeding will be
Mm-hmm.
more. The
Okay.
advantage in Dabigatran and other DUAC, no any
Mm-hmm.
monitoring at all, just oral taking without monitoring. And the good thing here also,
Mm-hmm.
as you mentioned, there is antidote.
Mm-hmm.
If there is
Mm-hmm.
possibility to be having a bleeding, we can do
Mm-hmm.
or we can give the antidote, which can help
Mm-hmm.
to control the bleeding.
Yeah, that's why I
This is
mentioned
good
to her
good
that
thing. Yes. Yeah, yeah. This is good
reversible
thing
of
to be
this
mentioned.
medication is very easy. Yeah, Yeah, but I didn't explain more.
Exactly.
Dr.
Mm.
Selma, you said when she asked you, you said to her you will take for life, right?
I told
Yes.
her it is
Lifelong,
possible.
yes.
It is possible to take it for life, but the decision about that it will be upon your evaluation assessment and your response.
Ah, is that right? Okay.
Exactly.
Yeah, yeah.
Yeah. Because once the patient maybe cardioverted to normal or sinus rhythm,
Mm.
the
Anything
patient
could
might
happen.
be.
Yeah,
Even the
yeah.
scenario
Yeah.
mentioned and clearly and until they take the
Exactly. Exactly. So
final
it's in the
decision.
scenario. Yes.
Mm,
Exactly. Yes.
mm.
Okay. Another
And she
point
asked
here,
also you about
Doctor.
heart attack. Heart attack. What was your answer?
She told one of my friends have bleeding and stroke as a result of bleeding. I
No,
told
other
her bleeding.
question, Dr. Me.
This
Dr.
also,
Me,
this
that
also,
are you sure that I'm not having any heart attack
Yeah,
anymore?
is
yeah.
it
I
re-
answered. I answered. We cannot guarantee that. We cannot say about that. But hopefully, with this medication, having heart attack or stroke or these problems from clot and thick of the blood will be minimized.
Why
Yes.
you ask that question, Dr. Baki?
This is written in the scenario I have.
Okay.
I don't.
MashaAllah.
Mm.
I'm not picking.
Dr. Bakinam is adherent to the task as a surrogate.
Mm,
She's
Yeah,
mm,
preparing the
I'm
scenario as a good surrogate.
trying to
Okay,
mm.
be a good surrogate.
be ready for your scenario, Dr. Baki, to be a candidate now. And
Okay.
let me read one more important comment. Yes, the childbearing period for the female, any plan for pregnancy and contraception was also makes sense to ask, especially she's still 40. At least raise this issue. If you are planning for any pregnancy or further pregnancy, please follow up with your woman doctor. Okay. But I think it's not that important to
Mm.
be raised. But if you have time, ask it. I'm not sure if Dabigatran is teratogenic,
Yes,
but as we
teratogenic.
Mm.
are talking,
I,
uh,
I read about this right now. It is teratogenic. It is
yeah,
contraindicated
is it?
in pregnancy.
Oh, okay.
Yes,
So
and
so
it
Yes.
is
it's important
excreted.
now.
It's secreted. Yes, it excreted in a small amount in the breast
Oh
milk
my
as
God.
well. Okay? But it
Okay,
is not much important. They told you can take it even during breastfeeding. It is a minimal amount and it will not affect the baby.
perfect.
So
That's
it is
why
not
we are
teratogenic.
discussing. No, it is. It is
It
teratogenic.
is. Oh my God. So I have to mention
Yeah, so
about
it's
the
important
pregnancy.
to raise. That's
A
why
lot
I
of
say,
point to discuss
Even
about
the
it,
Mm.
case
yeah,
if
to
you're
go
planning
through.
if you're planning to get pregnant, not during pregnancy. If you're planning to get pregnant, you never have to take it. Okay,
You will take
Mm.
planning
wait
or
for me.
okay, good. So that's why we are doing these meetings. We are not perfect, all of us. So anyone has information, please share it. We are following a frame, but sometimes the medication force us to ask, like this scenario with Dabigatran, with teratogenic. Please remember this point. This scenario, I think Dr. Salma and Dr. Bagi will never forget, and me, of course,
Yeah.
and all of the listener. Why? Because we raised this issue, we have a debate about it, and clarified by Dr. Maha, I guess. So it's clear now it is teratogenic. Please refer any patient in childbearing period if she's planning for pregnancy to follow up with her woman doctor before starting this medication.
yes.
Clear?
Dr. Basim, there is another issue. Okay, I will send it
Yes.
in the group. You can just read it for all of us.
Yes, sure, Dr. Maha. Thank you. Dr. Hatem asked Dr. Rashid why you mentioned dietitian. I agree also for this. Dietitian for warfarin.
I didn't mention that.
Okay.
أنا ما قلت الكلام ده.
Okay, dietitian for the INR and for the warfarin. Because a lot of medication and vegetables, green vegetables, have interaction with the warfarin. Thank you, Dr. Hatem. Dr. Salma, now your scenario, and Dr. Baki.
My scenario, I send it to you. I don't know how to write it.
Okay, I
And
saw it.
I
No problem.
don't,
I will share it. No worry.
yeah, and, just wait.
No worry, I will share it here. Get ready, Dr. Baki now.
Okay,
Okay.
in the group or the chat?
I'm
Okay.
bringing here now.
Okay.
Now it is here. Okay, you can see it now. Oh,
سؤال أخير
that's
معلش دكتورة سلمى.
yeah.
When
Yeah,
she
that's
asked
why
you,
I was hesitated, Dr. Basim.
About
Dr.
scenario, no
Rashid?
problem. I will read it. I
Yeah.
will read it. No problem. Doctor, yes, Doctor Rashid, ask please your
I
question.
معلش, she asked one of her friends develop with blood-thinning medication, I think stroke or something. She
Yes.
Bleeding,
mentioned
Yes.
that.
bleeding.
Actually, if I did the task well, she should not ask this question because I should explain to her when I explain the medication that bleeding is one of the side effects, possible side effects. But we are with regular follow up and giving you the dose just needed for you and by safety netting, this will not happen. But because I didn't mention this in the side effects of the medication, she asked me this question. So I answered her
Yes,
the
also.
same answer. The
Yes,
same answer.
besides
Yes.
this, you can tell also يعني this medication less chance to get bleed, not like warfarin. مثلا her sister or her friend, maybe she was taking warfarin.
Taking other medication. Yeah,
Other
yeah.
medication
You're
most
right. Yeah.
can cause مثلا
Yeah.
this bleeding, but this one is less chance to get bleeding. There is
Bleeding.
possibility, but
Yeah.
less.
Okay. Thank you.
Okay, perfect. Let's move to the next scenario. Anyone has question, please, he can write or after reading the scenario, he can ask. Dr. Buckingham Beridi, your role, you are the senior health officer in the medical wards. The problem, breaking bad news. Patient name, Miss Sahayat.
Suhaila.
Suhaila.
Okay, Suhaila Khalid, 33 years old woman. The scenario, yeah, Suhaila was admitted to the medicine ward because of pyrexia of
Pyrexia of
unknown
unknown
origin. Yes,
origin.
yes, yes. Yeah, for 6 weeks. Duration on a detailed history and careful examination. She has cervical and left axillary lymph nodes in which an excisional lymph node biopsy was taken last week. And today, the pathology lab rings you informing that the diagnosis is high-grade non-Hodgkin lymphoma. Sheila mother or Suhaila mother died last year from cancer breast, and she was her next of kin and suffered with her during her treatment course. She is married and recently gave birth to a 5 years old child or girl, and her mother-in-law is taking care of her baby at the moment. Your role to your task to break bad news. Don't examine. Okay, so address other concern. If you're ready, Doctor Becky, I will give you 2 minutes. Okay,
Okay.
just put a frame and scheme what to follow, what to do,
Yeah.
how
Don't
to
be
do.
afraid. It's easy scheme.
Yeah, please and please be more sympathetic and empathetic.
Mm.
It's the time to do that. Of course, for Dr. Salma, the same advice. Any question now for the previous scenario or any communication scenario?
Yes, Dr. Basim. Here, Dr. Ali.
Yes.
To be
Yeah,
honest,
Dr. Ali.
any patient, even on NOAC, he need to be referred to nutritional clinic.
Even on Dabigatran, you mean?
Yeah, no, I mean all, even in NOAC, oral and novel oral anticoagulant, you need to be referred to the nutritional clinic. This is mandatory.
Any instruction or any precaution? I
Yeah,
don't know.
because there is dietary restriction or concern that may interfere with the efficacy of safety of NOAC. I
Okay.
read the point now, and I listen from many minutes before.
Okay.
Wait, here, yeah. Yeah,
I think
yeah. It is most for warfarin, but also in NOAC we need to refer as general.
yes. Okay. Okay. Good. Thank you, Dr. Adil. But in general, if you are hesitant to say that, you can at least offer the leaflet brochures about the medication. Please read it carefully and follow the instruction inside. Because anyone, even us as a doctors, when we prescribe new medicine, we are trying to search about it, right? Sometimes we open the book, the books and reading the pamphlet, right? So it's okay to say that. Please read about it, the leaflet brochure, and you can say dietitian will follow with you, particularly in the warfarin scenario. In this scenario, okay, if you heard it, I'm not sure also about any interaction in the food, but at least the warfarin to be aware about the interaction with other food and vegetables with the warfarin. You have to mention it in the warfarin scenario. Okay, but otherwise, if you say or not, it will not be that effective like the warfarin. Clear? Any other question or comment? Anyone has comment to add? Dr. Aisha? Dr. Rabia? Any comment for the for
It is a
the
good scenario, Dr. Bassem. Just you mentioned already this point, but just to
okay.
be more
Yeah.
clear, start directly with your task, and you can
Exactly.
complete the other things after that.
Yes.
So if she can start by drawing the heart and explaining AF, then the medication, how to take, and is a good effect and a bad effect and the complication if not taking, then she will mention with atrial fibrillation explanation already. She will mention why it happened. So she will mention the blood pressure problem. After that, she can ask. You need, if the patient will ask, I will not have problem from like stroke and hypertension problem. She will be a good point to explain that she should be
Yes.
compliant to the medication, because yes, here it is the task is if and explaining medication. So she should very focused on this point before. To the discussion is opened and she will lost between the questions of the
Yes.
surrogate.
Yes, I agree. And I will add to your comment. If she's aware about AFib, don't explain it. If not, explain it. Because she might know about
Yes, she
AFib.
can ask, yes.
Yeah.
And
But I
about
think in
when
this
she,
scenario, yeah,
yeah,
sorry to interrupt you, but in this scenario, Dr. Salma, you forgot to say the heart racing. I wrote it in the comment. Heart racing showing that you have what's called AFib or atrial fibrillation.
Yeah,
You
yeah,
didn't say, you
yeah.
said there is investigation which show, but particularly it was the heart racing.
Heart
Okay.
racing. Yes, yes,
Yeah.
yes.
Okay.
You are
Go ahead,
right.
Dr. Aisha. Sorry. Yes.
only the also you point this issue about the empathy. She said, I have one friend have like that. I'm sorry for your friend. This will
Yes.
be the first sentence you will said.
Exactly.
And also give her a chance at first when you said it is like if and it can cause like stroke and like that. So you will you said I'm so sorry for that news and this is good, but the golden silence it is better to say anything. Then you can say this after that,
You
but
mean in the
give her
beginning?
moment, yeah, to absorb.
Yeah, sure.
Yeah, that's right. I will tell you something, Dr. Aisha. Thank you for your
Mhm.
comment. You always your comments are very precious to me. But when we practice the scenario for the first time, we are be occupied by do I know about Dabigatran? Do I know about this? But next time I notice always that I am making sure that I do it well better than now.
Yes.
So when
Exactly.
yeah, when I break the bad news, after the first few sentences, I noticed that I didn't give her the golden silence. That's right. You are right. I noticed that. So I told her, I go back and told her, what do you think about that?
Yeah, but the
Yeah,
way
yeah,
your
yeah.
explanation is excellent, really, Doctor.
Thank you.
Uh,
Thank you.
just
Thank you.
making it point before entering the station, making
Yes.
point,
Right.
so
Yeah.
you will be yes, you will be
Mm,
perfect.
yeah. Okay.
And
Thank you,
Thank
embassy
you.
Dr.
by
Aisha.
tone, especially very important.
Yeah, very important.
By voice tone.
Exactly. Yes. Okay. Are you ready, Dr. Bakinam?
Okay, yes.
Okay, I will start the timer. Now you can go.
Hello, I am Dr. Salah. I am the doctor of the clinic today. May I confirm that you are Mrs. Suhaila, 33 years old?
Yes, I am.
We are here to discuss some issues related to your health condition. Is this okay with you?
Yes, doctor, please.
Before going further, Ms. Suhaila, do you want someone to attend with us our meeting for support?
Thank you, doctor, for offering, but I'm okay.
Mhm. Can you tell me, Mrs. Suhaila, what do you know about your health condition?
Yeah, just I'm super exhausted, and I have high body temperature for the last 6 weeks. I don't know why this. I thought maybe some infection, something. So I came here, but they surprised me by taking a snip from my body. I don't know why. So I'm afraid now after that I will get bad news.
Okay, Ms. Suhaila. Do you have any
Mhm.
expectations about our discussion?
Yeah, as I told you, at first I wasn't expecting that thing, but after they took this step, I'm afraid of cancer, especially I have the cancer in my family.
I appreciate your concern, Mrs. Suhaila. Your concern is very valid. Uh,
Mhm.
Look, to be frank with you, the biopsy, the SNP result has been released, and
Mhm.
unfortunately, it is not like as we hoped.
Oh my God. So you are saying it's cancer?
Uh, yes, Ms. Suhaila, it is a type of a cancer,
Oh my
okay,
God. Oh my God.
called Non Hohdgkin Lymphoma. Do you have any
What is
idea
what is
about
that?
it?
I know. No, I don't have any
Uh,
idea what it.
it is affecting this nasty growth, affecting uh, your defense mechanism, the nodes which has blood which is responsible for defense, defending your body
Mhm.
from any other infection. And it affect uh, um, any gland in some gland in your body, some nodes. Okay, and I'm sorry to tell you that it is very serious.
Mhm.
Are you okay,
That
Miss
is
Shyla?
shocking. Just I need a minute.
Do you want any tissue,
Thank you, doctor.
any medicine
So,
or something, any help? Are you
thank you.
good?
So, yeah, I want to ask you. So, my mother died with um, breast cancer. So, my cancer is not in the breast. I understand that you are saying a gland. Where is this gland exactly?
Uh, it is different sites in your body because this gland is already there in our body.
Mhm.
This cancer affect the multiple nodes or multiple glands in our body. So it is in different places.
Okay, so
I'm
tell
sorry
me
for that,
frankly,
Mrs.
am I
Mhm.
going to die or is there any treatment or cure for this? Can you remove this?
Uh, yes, Mrs. Sohaila, I appreciate your concern. And I'm sorry for this hard news today. Uh,
Thank you.
we are here, we are going to involve a group of doctors, which the gland doctor and Macmillan sister, or Macmillan nurse, and gland doctor to form a team will be following you and giving you the appropriate treatment and the care you will need through this journey.
Mhm.
Is it okay
So,
for you, Mrs. Hayla?
so I have a small girl, 5 months old. Uh, can I'm nursing her. I'm breastfeeding her. Can I continue breastfeeding her?
I'm sorry to tell you that, Mrs. Suhaila, but possibly you cannot feed her, but the end word will be to the consultant. He will make another discussion with you to discuss what what will be appropriate for you and to help you through this illness. Is this okay with you?
Doctor, but I need you to answer my question clearly. Is this cancer curable or not?
I'm sorry to tell you that, Mrs. Sohaila, but this cancer is too serious and uh, the it is possibility that you cannot survive, but on the other side, we will be with you on this hard journey, and we will support you with the treatment, and we'll give you the full care and support you will need through this. And
So you're
also, I
saying
want to
that
tell
I'm
you
going
that
to die.
um, no, Mrs. Suhaila, I say it is a serious condition, but it is a possibility. But we will do our best to save you and to help you through this hard time.
Okay, doctor.
You have any concern, Suhaila?
Yes, doctor. So you are saying there is no cure, there is no surgery. So what do you
No,
think
Mrs.
they will?
Suhaila,
They.
I don't no. We will involve the team,
Mhm,
Mrs. Suhaila,
mhm,
which is forming from the doctor of
mhm,
the gland doctor and the cancer doctor,
mhm.
and they will offer the proper treatment and the choices available for you.
Okay,
Is
so
this okay?
this is okay, but do uh, uh, do I have to hope that it could be cured?
2 minutes left.
It could
Uh,
it could be the surgery, something to give me some time to be with my child. For how long?
I'm
Of course,
I'm
you
sorry
know
for
about this cancer, and if there is a possibility that I will live, and for how long?
I'm
Is it years?
okay. I'm sorry for that, Mrs. Sohaila. I cannot give you an answer for that right now. And
Mhm,
also I cannot give you a false hope. So what will be the right thing to involve the consultant will appreciate your condition in the right way and
mhm,
assess you.
mhm,
The team will assess you
mhm.
and they give you the all management you will need. I wanted to ask you some questions, Mrs. Suhaila. Are you
Okay.
okay with that?
Yes. Go on.
Okay. What do you do for a living?
I'm a housewife. Uh, I'm taking care of my child.
Okay.
Yeah, that's it.
Yeah, Suhaila. Through that, we will ensure for you the social worker, which who will help you through this
Hmm.
for
Yeah,
your child
yeah,
and everything
yeah. Thank you for
related to
that
this.
because my mother-in-law is taking care of my child now. When the moment that I'm speaking with you, and she is a very old lady. Thank you for that.
Yeah, yeah. This is very nice from her, but we will support you as well. And do you smoke, Mrs. Suhaila?
No, no, I'm not
Do you
smoking
drink
at all.
alcohol?
No, no, I'm not
Mm.
drinking alcohol. I'm living a healthy life because we have cancer in our family. So that's why I'm wondering why I got this. This is a
Good
shock
for you,
news
Miss
for me.
Suhaila, but you know, I'm sorry for that. I appreciate that it is very hard news for you. Do you have any other concern?
No.
Okay. Can you tell me, is it okay? I will summarize for you that uh, this condition we will need to involve our team. Okay, we will help you through that, and also I will be giving you some leaflets and the brochures. We will help you, and also I will involve the mood doctor to help you also through this stressful time. Okay, and any other concern?
No, thank you, doctor. Thank you.
Okay, time is up. Thank
I
you.
think
Dr.
Dr.
Yes.
Dr. Basim, I think non-Hodgkin lymphoma, in non-Hodgkin lymphoma, people can live about. I have actually a friend with non-Hodgkin lymphoma who lived for 10 years. 10 years.
Yeah.
Sadly,
Yeah.
he died about 3 years ago.
Uh-huh.
But he lived 10 years. So that's why I was thinking that non-Hodgkin lymphoma has somehow good cure, even if it is high grade. Not cure.
Yeah. Don't
What we
say
call
cure.
it?
Yeah.
No, not
Yeah.
cure. What we call it? Good
prognosis.
life
So
lifespan, life prognosis.
life
Yes.
expectancy.
Yeah.
Life
Life
expectancy. Okay.
expectancy. Yeah. Life expectancy. Yeah. That's why. Yeah.
But still, it carries poor prognosis compared to the Hodgkin one, right? The
I
Hodgkin
told you
lymphoma
my
carrying.
friend has
Yeah, yeah,
non-Hodgkin
yeah, yeah, yeah.
lymphoma. Yeah.
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 You're right. Non-Hodgkin might live longer, but still, it's one of the worst prognosis according also to the subtype. If you remember, there is a
Yeah.
schedule about the
Yeah.
histopathology type.
Yeah.
But
Actually, if I am in her place, I will not tell it like in an excited or happy thing. No, but I will tell that the survival rate for non-Hodgkin lymphoma could be extended for years, but we cannot decide upon now. We need
yeah,
regular follow-up with for you and a meeting with the MDT. But the life expectancy is for
valid.
is varied, but for most of the patients it is years. It is years
Don't
for
don't
60%.
mention. You don't know if she might live low years. She might live shorter, and it might be months. So we don't know, as you said, we don't know exactly what's the life expectancy for this type, with this person. We
But
are not
really,
sure
Dr.
about.
Basim, it is known any lymphoma has good life
No, no,
survival.
Yeah,
It
not
is
yeah,
from good
yeah,
cancer. They
not
said
any
like that.
yeah.
lymphoma. The
It is
Hodgkin,
good cancer.
the Hodgkin one. Yes, what's the
The
Hodgkin one,
both,
Doctor
both
Raj?
types, both types. Really, both types
Yeah,
have near
yeah, yeah.
life expectancy.
Life expectancy. My friend lived 10 years with non-Hodgkin lymphoma. In
It
the
is from
beginning,
the
he
good
was
cancer.
afraid to
Like
start
there
his
is
life
good cancers in
very,
communication,
yeah,
and you should not make drama in them. And they
yeah,
deduct the marks if make drama because
Okay,
they
why?
like it is clinical judgment. You face it in this if you make a lot of
yeah,
drama and let patient
yeah,
thought that he will die through a year
Okay.
or months. The patient said,
yeah.
"I not lactate my baby." And so
Ab-
they make
yeah.
her think she will die tomorrow. Like
Yeah,
that.
Okay.
about lactating the baby, the answer should be cancer itself will not affect nursing your baby, but the treatment of the cancer, which will be
Yeah,
decided by the
chemotherapy.
MDT,
Yeah. Yeah.
might interfere and they might
Yes.
stop you from nursing your baby. But up to now, the cancer itself will not be the cause of
Exactly.
stopping, yeah, your nursing.
Yes, exactly.
Yeah.
Okay, the other concerns, Dr. Salma, any concern else you want to correct?
No, she did well. More sympathy and empathy. That's because also this specific person, she has family history of
Yeah,
cancer.
yeah,
Her mother died, and
yes.
she is just married and just give birth, and she's afraid and concerned about her child. So more sympathy and empathy, like Dr.
Yes.
Bakhan did, is very good, and that's very good. But in the life expectancy, she should not be that. She told me you will expire. She not
No,
this
no.
word. What
The,
word
the
do you
best,
use?
the best answer,
Yeah,
the best answer. I always say it.
I
yeah.
said
That
the team will judge the
not only that,
consultant.
the nature of cancer always
Mm,
or usually, sadly, it shortens the patient life, and this is for any cancer. You don't have any expectancy for how long. Yeah, it might be
yeah,
longer, but it might be shorter. So the nature of the cancer always make the patient expectancy life less than expected, especially if he will take, for example, chemotherapy. Chemotherapy might make
mm,
him immunocompromised, so he might die from other complications rather than the cancer itself. So don't be clear in this answer, either years or period. Don't mention it, but you can say, as general rule, the cancer itself shorten the patient life. But for your condition, we have another types. We have to make another meeting to answer this question clearly. If we have,
yeah.
I said so, but doctor insisted to get the answer from me.
والله
You,
دكتور باسم
you,
uh,
you know why? Dr. Maha
Yes.
answered you, Dr. Buckingham. You see, Dr.
I'm
Maha, what she
curable
wrote?
non-Hodgkin lymphoma,
Yeah,
whatever the
low. I
degree.
will tell you
I know
something.
that.
Yeah,
I
yeah.
am sure
Low
about
grade.
that.
Yeah, it
Even
is
high
high
grade.
grade. High grade non-Hodgkin lymphoma has a worse prognosis but a higher cure rate.
Higher
So,
recurrence also. Higher
uh,
cure rate and higher recurrence.
yeah. So, I keep asking you because I know that the life expectancy in non-Hodgkin lymphoma is good, not very bad.
Yes.
So if
Mhm.
Doctor.
I want you just not to use the word that what Dr. Basim said is good. You can say that cancer in general shorten the life, but in your case, this type of cancer actually has a successful rate in the treatment modality. But
yes,
Mhm.
still, to
Yes, about
decide
also
for
treatment
how long,
modality. I think
أيوة.
she said no
Mm.
treatment, or
yeah. She
she
mentioned no
didn't
cure.
mention treatment.
He said no cure.
Yeah,
There is
Yes, I didn't
accepted
know. He
treatment
say
now
high
with
grade.
high, yes,
if
with
you
higher
if you
Yeah.
don't know, you
recovery.
can
Yeah.
tell her that treatment could be in the form of
No,
medication,
but I
in the
said
form of
I tried
chemotherapy.
again to get
Yeah.
that okay, doctors will decide
Yes,
the team will decide, not me,
Mm.
Dr.
according to
Bakinam,
your yes,
you are
doctor.
lucky. You are lucky. All of this doctor comment, you will
Yeah,
never forget. No, you will never forget it.
a
You
lot
will
Yeah.
of
never
comments.
forget this comment. Yeah, really. This scenario will be
Yes,
Yes,
memorized.
this is very good
thank you,
scenario
doctor.
because it is
Yes.
come before, and when the candidate make like it is miserable, they failed
Yeah.
them because
Yes,
They
because
fail.
they
Yeah.
having some cancer that I wrote it's
Mm.
five cancer has good prognosis. They when they bring them in communication, they need from you to know that, and
To know
not to
that.
make a lot of drama in
Okay.
your case and
Can
making
you
the patient
enumerate them, Dr. Aisha? Enumerate them. The lymphoma, one of them.
Or send
yes,
them in the group. Yeah.
yeah,
Yeah.
lymphoma and
Okay.
Mm-hmm.
testicular cancer,
Okay.
thyroid
Mm-hmm.
cancer, sometimes also يعني, prostate cancer. But
Okay.
then went to Fumio to said that there is treatment and it is effective in a lot of patients. Just this
Okay.
sentence.
Yeah. This sentence.
Give
Yeah.
hope,
Yes.
just
what?
hope,
Can
because
you
there is
repeat it
hope
again?
here.
Mm-hmm.
The
Can you repeat it again, Dr.
melanoma,
Aisha? Mm-hmm.
lymphoma, prostate, testicular, and thyroid.
Mm.
Which is
It
the
is
psychologist thyroid?
this cancer
What
we
sentence
say
I have
really.
to say?
I know a lot of ones have testicular or thyroid, and they're
Yes, you're
living more
right.
than 10 years
Yeah.
really.
Yes. I know
I have
also.
But
also a hint, Dr. Basim and Dr. Aisha. I have also another hint I am using. I don't know if this is right or not. If the scenario did not mention metastasis, that means they
Yeah.
don't want you to break very bad news.
No,
The
but wait,
scenario,
it's the task is breaking bad news. It's still breaking bad
yes,
news.
yes. No, I told very bad news.
Okay.
Very bad news. Yeah, I told like that. Yeah. So if the scenario did not mention metastasis, you read your scenario. If the scenario told this is the first diagnosis of a cancer, and this cancer is,
Not
they did not
spreading.
mention that it is
Yeah.
spreading, that
Mhm.
means it is not very bad news. So you break the news about cancer, but when she is asking about the treatment, you tell her that yes, there are a lot of modalities of treatment, uh, and you will sit with the MDT to tell you about that. Am I going to die?
Yes.
The life, the cancer generally shorten the lifespan of a person, but in your case, there are some modalities of the treatment. They will be discussed with you, and we hope that it will benefit in your case. Do not
Mhm.
tell that
Yes,
she will
because it is
die.
a lot of ones benefit from you should not make percent, but you should make
Yeah,
hope. It is a lot of
hope.
person like you benefit from
Mhm.
it. Yeah.
Benefit from it. Yeah,
Mm.
yeah, yeah. They will discuss with you some modalities of treatment. A lot of person in your condition benefit from it. Just like this.
Okay.
Yes, yes. Okay.
Okay.
Yeah.
Let's
Uh,
add
uh,
another comment for Dr. Rakram. Whenever she mentioned to you some person in her family died,
I
be
didn't
sorry.
say, yeah. So,
No, no, you didn't. You didn't say I'm sorry about your loss or your
um,
mother. Okay.
yes.
Even if
Mm,
she died a couple of years ago, 10 years ago, if she
mm,
remember here now, you have to be sorry for that. I'm so sorry for your mother loss.
mm,
My condolences for you and your family. Like this. Okay.
yes. Mm.
Uh,
I want also
y-
someone to explain the disease. أنا الإكسبلانيشن بتاع الكونديشن
yes.
نفسه
Yeah.
محتاج
Okay.
حد يقول لي
Yeah.
عليه.
It's a blood disease, right? It's a blood cancer. Lymphoma is a blood.
Mhm,
So you will refer him not to gland, to the hematology, okay, and
mhm,
oncology. Or you can say cancer doctor, don't
mm,
specify. Cancer doctor, whatever the cancer origin. Back to the explanation. I wrote it in the group yesterday. By the way, Dr. Tanvir was asking about it. I wrote, it is a cancer of a gland responsible of defense system in the body. These glands distributed in certain areas in the body, in the neck, in the area under the arm, in the area near to the groin. So any of these glands might be enlarged as in your condition. She will say, yes, doctor, I noticed that it is big in under my arm or under the neck or behind my ears, like that. Okay, this is the explanation. So it's a gland responsible of the defense system of your body. It attacks the bugs whenever you have bugs coming inside your body. Simply and shortly. Okay. If you want to explain about the
Oh,
lymphocyte itself, lymphocyte, it's
yeah.
one of the cells rotate in the bloodstream and the cancer in these cells. And these cells deposit or stayed in the glands under your arm and under the neck and so on. The same explanation. If you want to
Yeah.
specify that lymphocytes. Clear now?
Yeah. Yeah. It's a overgrowth of like you said, nasty cells in your
Mhm.
in a system called lymphatic system. This lymphatic system is part of your defensive system. It's also a network like the blood channels,
Mhm.
responsible for defending your body. This nasty growth or abnormal growth happen in this system affect your defensive system. That's why make you vulnerable or weak and have multiple infections, multiple bug infections, and affect your I don't know the rest of it, but this is how to mention the lymphatic system.
Mhm.
It's
Yeah.
a system or network of channels, same as your blood channels, but responsible for defending your body from bug infections. It
Yes.
consists of this network and glands. The glands
Yeah.
that we take a snip from. It's
Yeah.
scattered in your body and it is defending your body against the bug infection. That's why when you
Exactly.
have a cancer of this, you will be vulnerable for multiple bug infection and your body will be vulnerable.
Yeah. In 2 minutes,
Yeah.
not more than that, Dr. Bakinam.
More
Mhm.
than yes, yes.
Thank you, Dr.
This
Salma.
is, yeah, this is another way.
Thank you, doctor, for commenting. This is very
Okay.
helpful.
Okay. Another thing, what about palliative in this scenario? Is it one of the task hidden agenda? Because I expect to speak about some chemo, radio, because the main
No, it is not
management
palliative
plan,
because I told you,
chemotherapy.
yeah, chemotherapy. Yes, this is the treatment, but it is not palliative. It is a treatment.
IV
Actually,
chemotherapy.
yeah, you are
Chemotherapy only,
afraid of
okay, without
saying cure. What is
palliative.
this
Okay.
cure?
Yes, yes. It's as you said, it's cure, but
Yeah, chemotherapy, radiotherapy, monoclonal antibodies, all these have been tried.
steroids,
Yeah, tried in non-Hodgkin lymphoma.
the steroid as well. I think dexamethasone
Mm,
one or
mm,
prednisone.
mm.
Okay.
Be sometimes they didn't mention, and they use supportive treatment.
Sorry. The palliative itself, yeah, no need to mention palliative. But
Yeah.
Yeah,
we
no
will
need
support.
because it's
We will
yeah, it is
support
not.
you. We will follow up you, and we during all this journey, we will support you. Always support Dr. Bakinam in any scenario with breaking bad news. Once you break the news, reassure about the support. Yes.
Dr. Basan, can we ask you for B symptom to support مثلا to add medication like that to support him or no need?
For what? Sorry
B
again.
symptom of lymphoma.
B
Can we ask
symptoms?
you
No,
in
no,
this
no. Don't
scenario
ask. No, 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 no.
in
It
order
will
to
be
give
considered
the
taking history.
supportive medication like
But you will be
May,
taking history if you ask.
yeah, maybe the examiner will think that you are explaining palliative. If you told, if you have fever, we will treat your fever. Pain, we will treat your pain. Like this, the examiner. Mm,
I'm thinking to tell like this.
Yeah, but it is one of the supportive. It's okay to mention that
Yes,
mm,
you
if
have
you have any
history.
fever, any headache, any pain, I will give him support treatment.
mm,
We will be with you in this journey. We will
Yes.
support you. We'll be sure that you are free of symptoms. Don't mention if she asks, you can say, but we will be sure that you are free of symptoms. This
Yes,
is your
exactly.
aim, target management, right? You want your patient to be free of symptoms. Whatever the symptoms, you will offer. If she mentioned to you, yes, doctor, I have fever, okay, we will guide you with some medication to help you in this fever, or infection, antibiotics will be prescribed according to the concern. But leave the patient talk a bit because she will raise a lot of concerns.
Yes, exactly.
Okay. Okay. Any other question or comment? I can see a lot of comments
yeah.
here.
No, just
Yeah.
me and Dr. Bakinam today. We learned too much. Dr. Bakinam, don't be afraid. Me also, first time I know about Dabigatran and I make this scenario.
No, it's
And
very good
yeah,
to listen
and
to the comment. Yeah, very useful.
I was preparing this scenario actually also to learn more about non-Hodgkin from our colleagues. The same idea and the same aim.
In fact, these sessions and this meeting started since 1 year. Imagine still the scenarios re reopened again. It's not it's opened new scenario. Believe me, since 1 year, communication every other day. We didn't discuss the Dabigatran and we didn't discuss the non-Hodgkin lymphoma. We discussed the Hodgkin lymphoma. So it's a matter of really a great benefit for all of you. You are raising the issue and the point and the topic, and we are also learning from you. And this is the main aim of
Yes,
this meeting. So
yes,
at least to know this meeting points better than facing it in the exam.
yes,
So you are lucky to learn and to hear these topics, Dr. Bakinam and Dr. Salma. Once you raise
yes,
it, you will teach others, and of course, you learn from the comments.
yes, of course. Thank you. Thank you so much.
Yeah, thank you also for all of you. Any comment else?
Thank you, doctors.
Okay, Dr. Baki. I read some comment here to
Very
speak
nice
about.
session.
Yeah, as usual, it's by you and always precious by you. But not to speak about end of life. Yes, it's not the task at all to speak about end of life unless they mention to you that the cancer, as Dr. Salma said, spread everywhere, lymph node, spleen, and I believe there is division or grades accordingly. If the spleen or the lymph node groups on two sides of diaphragm, it would be stage 3 or 4. And if the liver also involved the spleen, but it if not mentioned means that it's not spreading. It's just for the lymph node. Again, so we'll be back to the good prognosis as Dr. Salma said. B symptoms was also one of the bad prognosis. If there is B symptoms, it would be of poor prognosis. And even most of the advanced stage non-Hodgkin lymphoma has a survival rate greater than 60%. Thank you, Dr. Aisha. Palliative is hidden agenda. I was wrong by this comment, so no one follow this. But the prognosis of lymphoma is good. Why can't they speak live? Yes, we speak about that.
Yeah, Dr. Basim, I will tell you something. My friend died only when the non-Hodgkin lymphoma spread to his pharynx. This is the after spreading to the pharynx, he lived only six months. Can
Oh
you
my
believe
God.
that? He lived for 10 years and he married, has children. Everything was good and he was doing his job very good. But
Yeah.
when it is spread into his pharynx, immediately 6 months later he died.
Yeah.
Yeah, that was the condition.
Okay.
Yeah, Allah yarhamu, inshallah.
But not speak. Okay, prognosis. We mentioned this. We can say high grade is fast growing one compared to low grade non-Hodgkin lymphoma. This is by Dr. Umayma. There is treatment, but respond to it different from one person to other. Yes, always be vague in the answer. It might be varied from person to person, from cancer to cancer, even your condition from your condition to another patient with the same diagnosis. We don't know what will happen. Patient has the high grades. We don't know, Dr. Aisha, although there is procuria, we mentioned this, no role for palliative in this case. I agree. Thank you, Dr. Zainab, for correcting me. No palliative. Thank you also, Dr. Hatim. Speak about the plan because had high cure rates. Yes. Possibility of chemotherapy should be raised in this scenario. It might be the hidden agenda, the chemotherapy. You might receive some medication, it might help to cure this cancer or to regress the growing of this cancer. Because this is the main aim and the main cornerstone of the management of any lymphoma. In this case, they specifically said don't take history. Yes, no one will take history. Dr. Rashid, which type of thyroid testicular cancer, good prognosis? The thyroid, I remember the medullary thyroid and lymphocytic. I'm not sure. Also, there is
All cancer of thyroid good prognosis
all cancer.
if not metastasis away. If
Okay.
no any distant metastasis, they all have just the anaplastic type, but the medullary
The
follicular,
anaplastic is the worst one. Yes.
yes, this is not good prognosis. But for
About
follicular
testicular,
medullary, the commonest, all the commonest has good prognosis if not metastasized outside the thyroid, distant يعني, not the lymph nodes. The lymph nodes also has good, not bad prognosis.
Yes. Thank you.
what about the testicular معلش دكتورة؟
Testicular, I searched for it now. It is also most of them, just the non-seminoma, that is the least 70% 5-year survival, but the seminoma and a lot of types have more than 90. So more than 95 years, it is very good prognosis for any cancer. So generally,
Surgical
when they
resection,
bring
right?
these scenarios, they need from you to give a hope. Just this point. They need from you give a hope, not
I
making
agree.
it like
Or
the
at
other
least
cancers.
I agree.
don't make it like
Except if they make metastasis in the scenario.
yes, you're
If
right.
Yeah.
not,
You're right.
have this point, they need from you in this scenario not dealing as the other cancers.
Okay.
because there is hope. Really, there is hope in this cancer. So don't manage the scenario as very as the patient
As terminal case.
as the other
Yeah, as
scenarios
terminal.
that we did a lot. The
Yes,
cancer
you're
with
right.
metastasis patient within the ill like that.
Okay. So
Yes,
don't
I
make
agree
it.
with you, Doctor. So, especially this scenario, I think it's tricky. They're selling high grade
Yes, they
جريسين ما
bring it
بعرف
from
ايه.
this, they bring it to time by melanoma and also by
Yeah,
lymphoma. If they
yeah,
bringing this scenario, make sure that they will deduct if you will not give a hope because
yeah,
they
yeah,
know that this cancer from the highest, this is the
Mm.
only cancers have cure. In thyroid, they now they said that this needs cure. From thyroid
Yes,
cancer, there is cure, complete cure. So if you make
yes.
drama and the patient, if he didn't sit in the scenario that is metastasized like that, so you don't
Mm.
make like no hope. If she asks you, there is hope and a lot of patient cure and a lot of patient benefit from the medication and they can
Yes,
live
yes,
maybe years. You can say it like that.
yes,
Yes.
yes, yes. In multiple myeloma, you remember that in one type, the patient cannot take any medication, just observation.
Yes, if no any symptoms and no any
No,
yes,
no,
if no
not
symptoms,
symptomatic. Yeah, no
they
symptomatic.
didn't give anything. Yes.
Anything else? So I agree with Dr. Aisha. This scenario specifically, you need to tell the patient about high grade in one situation. That you want to tell the patient that we need to start the treatment by the way because it is spreading very it can spread very it is aggressive and can spread very quickly when the patient asks you that I am nursing your child, this is the time when you tell her because of the cancer itself you can continue no problem with your nursing, but because of the treatment which you should start immediately because this type of cancer is highly aggressive and can spread very fast. That's why we need to start you in the treatment, by the way. So this might affect the treatment itself, might affect your nursing to your child. So just wait for the MDT when they will sit with you and tell you about the plan of management. We will start the management, by the way. You need to tell her this. That's why they told high grade because you need to start the medication very early.
Yeah. Yes.
Yeah.
Okay.
Dr. Salma, I'm currently doing hematology.
Mm-hmm.
So what we say to the patient is similar to what you said. Like they say, there is a different modalities and advancement in treatment.
Mm-hmm.
And our target will be is to cure.
Mm-hmm.
However,
Very good.
however, the prognosis will depend to response to treatment. So we
Very
need
good.
to start
Yeah.
treatment as soon as possible, and then we'll
Mm-hmm.
assess your prognosis depend on your response to treatment.
Very
Sorry,
good.
guys. So
Wait,
this
Very
is.
wait,
good.
sorry. Why you didn't talk earlier, Dr. Zainab?
Yeah.
I was trying to, but everyone
Yeah,
is talking.
very good
Don't.
So
sentence.
Dennis,
Very,
from
very
my
Very,
precious.
experience,
very.
like,
Very precious
You get
comment.
it
Yes.
from the end.
Yeah.
next
Yeah.
so this is what.
next
كويس
time
دكتورة
you will
زينب
put.
ها؟
You just summarize what I want to say. You just
Yeah,
summarize what I want to say.
and this
This
is what we
scenario.
actually like
Yeah.
literally say to the patient, like your prognosis will depend on your response to treatment.
Sponsor
But for
treatment.
now, we'll start treatment. We'll be hopeful as much as we can. We'll support you during your journey. Sorry, guys, my voice is just.
Salamat.
No
Um,
worries.
we'll
Salamat.
support you during your treatment. If you need anything, any help, we'll be there for you. And you have to always tell the patient that we'll give you a booklet
Mm-hmm.
Mm-hmm.
about your disease. And you
Mm.
also say that you'll be in contact with what is it called? Nurse
People
practitioner
like
all the
you.
time.
Yes.
Yeah.
Or
Yeah. She
also
said
society or
McMalene.
people like you. Yeah.
Yeah,
Yeah.
she also mentioned Macmillan nurse. If you said Macmillan nurse, you have to explain that
Yeah.
this is the
Uh,
nurse, yeah, who will be responsible for with you
Chemotherapy.
in your journey
yeah.
with the yeah
Yeah,
for
there
the
will be
assigned
you
treatment.
can just
Yeah,
say there is a specialized nurse will be always in
specialized
contact
nurse.
with you.
Yeah,
Yeah.
yeah, yeah.
So yeah, I think that
Perfect,
Yeah,
Dr.
this is
Zainab. Really,
yeah,
thank you
precious
for your
comment. Yeah, thank you.
comment.
Thank you, guys.
And please, any one of us has a specialty regarding or related to the case, he can just clarify the things before more discussion about the things and to
Yeah.
clarify the debates. We had a lot of conflicts, but always it will be much better explained and justified by the specialty itself. So don't hesitate to talk and say, I am from this department, I am from this specialty, I have experience with this scenario, I have experience with this case. It's okay to speak. Okay. Thank you, Dr. Zainab, again for your comment.
Thank you.
Most welcome. Any question else? I can see some comments last regarding the Dabigatran. Yeah, Dr. Rashid remind us assure the patient to take the specific on specific same time on every day BID. Yes, the dosage is BID. I remember. To be compliant is the most important, but at the same time, it's okay. Better to be, but it's not the much important as well as the compliance itself and the adherence itself. But it's better to be in the same time. Yeah, I agree.
For
Doctor,
life is one, and life is one for all anticoagulant should be like this.
yes, yes. So it should be yes with the action.
Not
Yes,
like antibiotic, not like other medications. Especially this anticoagulant should be, and as much as possible, they can take on same time better.
yes, you're right. You mean for the half life and the action and
Yes,
yes.
yes.
Thank you, Dr. Rashid. Dr. Marwa wrote even in chronic lymphocytic leukemia only follow up. So you mean is as palliative, chronic lymphocytic, or the same responding to the medication and chemotherapy? We can ask Dr. Zainab here. Chronic lymphocytic leukemia, is it curable the same as lymphoma?
I think what she means that some CLL doesn't need treatment. You can just only monitor their bloods. So I think that's what she's saying. Like just follow up of the blood. And
Okay.
some CLL you can treat. Yeah.
Yes, I remember it is according to the thrombocytopenia, right? Thrombocytopenia. Yeah.
Yeah, it depends on a lot of things.
Puberty.
But yeah, but
Yes.
you
Mm,
can just sometimes follow up and sometimes you start chemo.
chemo.
Yes.
Yes, that's right.
Yeah.
I remember this. Yeah.
Yeah.
Yeah. Okay. The last comment, specialized nurse, better to be mentioned by Dr. Maha. Okay. I like also to say specialized rather than Macmillan, and it might be not the nurse assigned to this case. Yeah, Macmillan for the palliative, we know about it, palliative and for the chemo. But in other scenario, make it as a rule, specialized nurse, rather than to mention the specialty of the nurse. Okay. It's a nice session. Thank you, Dr. Salma and Dr. Baki. You raised a very important and new topic, the Dabigatran as DUAC, and also the non-Hodgkin lymphoma. We had a lot of discussion and everything now clear for all of us, really. And anyone has comment or question? Is it clear all for you?
Yeah. Clear. Thank you so much.
Thank you too. See you
Thank
tomorrow,
you.
inshallah, with the clinical day, short clinical day. Good luck to all of you and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.
Salam.